great people, you're welcome back to Health Conference YouTube channel with Mary. Yeah, today we have something really important to address. Yeah, we're gonna be talking about coronavirus disease today. Yeah, I mean, we need to know what to do to stay protected from this global public health concern. Yeah, of course, it has become so alarming, and we're gonna be dealing with it today. Okay, so what is coronavirus disease? Coronavirus disease, shortened COVID-19, is a disease caused by coronaviruses, and the novel coronavirus in particular is a strain of the virus that has not been identified previously until the year 2019. That is why the 19 is attached to the COVID, showing the year in which it was identified. Okay, so let's look at the signs and symptoms of this disease. Like, what do you expect to see in an individual who has contacted this infection? Okay, so looking at the signs and symptoms of coronavirus disease, we talk about fever exceeding 38 degrees Celsius, weakness of the body, generalized weakness of the body, nausea and vomiting, diarrhea, and then respiratory symptoms like coughing, sneezing, runny nose, shortness of breath, difficulty breathing. These are signs and symptoms that set in during the early stage, but in the advanced stage there is pneumonia, bronchitis, kidney failure, and even death. Talking about the incidence of coronavirus disease, there's been a great outbreak of this disease in China, of course, where it started, Italy, Iran, Nigeria, US, and it's just gradually becoming a global public health concern, and of course we need to tackle this. So it is really important we know how to prevent the spread of coronavirus disease. Okay, so looking at the causes of coronavirus disease, it is a zoonotic disease. That means these viruses are present in animals, and of course it passes from animal to man and also from man to man. So once an individual gets infected, this individual is capable of passing it on to another individual. So exposure to the viruses from the individual, of course, they are present in respiratory secretions. So whenever an infected individual coughs or sneezes, he or she emits these viruses in the droplets. So by way of getting in contact with these droplets, you can become infected. Yes, if droplets get into your mouth or nose, or you inhale mouth, nose, or eyes, you can become infected. And also by eating an animal that has been infected, you also can become infected. How can you prevent contracting coronavirus disease? How can you stay protected from coronavirus disease? First, distance. Avoid exposure to large droplets. So you have to keep a distance of no less than 2 meters away from anyone who is sneezing or coughing. Keep a distance of not less than 2 meters away to stay safe from these droplets. So still use a face mask. A face mask can help prevent your exposure to these large droplets. You need to use a face mask, and do not reuse your face mask. Do not use again the next day, and also do not touch the outside of your face mask, because of course you're protecting the bacteria from getting you're protecting yourself from the virus, so the virus does not get to you but can stay on the face mask, on the outside of the face mask. So please do not touch the outside of the face mask. Once you're done with the face mask for a day, you discard and use another one the next day. Thirdly, wash hands thoroughly. Wash your hands when you back from outside. When you come back home, before you touch anything, wash your hands. You have to wash your hands thoroughly. Wash in between the fingers, under the nails, wash everywhere. 20 seconds is ideal. You have to wash your hands thoroughly for 20 seconds. Enough time to sing happy birthday twice. The happy birthday to you, we know. Wash your hands for 20 seconds thoroughly. Number 4, avoid crowds. Avoid crowds. because if you're in a crowd, and of course the space between two persons will be shorter than if you were in a spacious place. You may not be able to avoid droplets from one who is sneezing or coughing. So avoid crowds, please. And note that you may not be able to spot one who is infected with coronavirus, because some people don't show the symptoms. Some people get infected but don't show the symptoms and still are capable of infecting others. So avoid crowds as much as possible. Number 5, you have to clean all your utensils. Clean high touch areas, high touch surfaces every day, like your doorknobs, your counters, your tabletops. Clean them every day, because these viruses could stay on them. And also for your hands, if you cannot afford to wash hands, maybe because there's no water, there's no soap, or there's just a problem, you can use hand sanitizers, alcohol based hand sanitizers with at least 60% of alcohol. Yeah, you can sanitize your hands with this and ensure you wash every surface. You can sanitize surfaces that can withstand alcohol. To sanitize your doorknob. Sometimes you come home and you're not able to wash your hands before opening the door. Yeah, open the door, go wash your hands, but make sure you sanitize the doorknobs. Okay, ensure you cook your foods thoroughly. Your meat, your egg, cook them thoroughly to destroy every microorganism that could be present. Yeah, please cook them thoroughly. You may not enjoy eating very soft meat, but please, you just have to. It is ideal. And some of us are just fond of using just any spoon to scoop from a pot. Of course, in a pot, so many people eat from it. So many people eat from a pot. So you just scoop into a plate. Please use a serving spoon to scoop. Use a serving spoon to scoop. A serving spoon just for scooping. You scoop into a plate. You scoop to another person's plate. Don't use your eating spoon to scoop from the pots. Okay, so what do you do when you're infected? Let's look at the management of coronavirus disease now. What do you do when you're infected, or what do you do when you see an infected person? When you see an infected person, you have to notify your local health authority. Yes, for the person's care and others' safety, to prevent the spread. So when you feel any of these symptoms, please notify your physician. I didn't say go to the hospital. I said notify, because you may not have a physician's contact. Visit the hospital, but you must take extra precautions to prevent the spread of this infection. Now let's look at the steps you could take to prevent the spread of coronavirus. Number 1, you have to stay at home except you're going to get medical care. Like, you have to stay away from school, you have to stay away from work, you have to stay away from public environments. Just stay at home except you are going to get medical care. And even though you're going to get medical care, ensure to notify your physician before you go. Not I am coming, but I am coming and I think, okay, you complain, you make your complaints, tell your physician what you feel. And if you think you have been exposed to the coronavirus, let your physician know. Just give your physician all the information to get others protected from this infection. Also, separate yourself from people and animals. Separate yourself from people. Of course, you wouldn't want your loved ones to all become infected. Separate yourself from people, separate yourself from animals, separate yourself from your pets. So if you must, whenever you're sick, let a relative care for your pets, care for your animals. If you must interact with your animals, please use your face mask, protect yourself. Use a barrier and protect the animals from becoming infected, because they can become infected and spread the infection to others too. Cover your coughs and sneezes. Yes, whenever you cough, make sure you have your face mask on you whenever you cough, whenever you sneeze, just to keep others protected. And no one should enter the room in which you are without a face mask. If one must come in, never without a face mask. Also, take other measures discussed earlier in the prevention, not because you're trying to prevent now, but because you're trying to protect every other person from contracting this infection. Clean high touch surfaces like the doorknobs, your tabletops, and every other places. every day. Wash your hands from time to time. Avoid sharing personal belongings. Of course, we mentioned those personal belongings, so just avoid sharing them all. Stay safe from coronavirus disease. And lastly, I would like to advise public environments like eateries, restaurants, and take measures to keep your staff and customers protected. Like, I visited an eatery 2 days ago, and just the security man at the door was giving hand sanitizers to everyone coming in, and every other staff was using a face mask. So please, public areas, try to keep your staff protected, try to keep the customers protected too. Please stay safe from coronavirus disease. With this, we've come to the end of this video today. Share whatever you think should have been added to this video, your comments, like the video, and subscribe to this channel if you haven't yet. Thank you for watching. See you next Friday. Bye bye.